All right, so Paul asked me to close everything out today, which means I'm the only thing between you and your car. So I'm going to try and keep this quiet, a little bit quick. But a couple of housekeeping things I want to reflect for a moment on today. So first of all, we have an evaluation up here. This is the first event like this we've done, and we're very much at every turn trying to be driven by our audience. We want to know what worked, what didn't work, things that you liked about today, things you would have liked to have seen. We try and be responsive to each of these. So we would really appreciate if you would take just a moment and fill out that evaluation. Additionally, we got some inquiries today about forming collaboratives and communicating outside of this venue and the possibility of sharing a list of contact information and who's who, so that if you want to reach out to somebody and hear more about what they do, we would be happy to do that. If for some reason you are not comfortable with us sharing the information that you provided us when you registered, if you'll just see one of us real quickly, we'll make sure that that information doesn't go out. But without objection, we thought that might be a good opportunity for us to deepen our collaborations and deepen our relationships with one another. So like I said, if you, for some reason, any reason at all, don't feel comfortable with that, please just see one of us and we'll take care of that. Additionally, Paul asked me to talk a little bit about the Innovation Center and what we offer. Very briefly, this center is a public-private partnership. It's funded by the state of Georgia through the State Office of Rural Health in order to really focus on rural health issues. And we think about that very, very broadly. We do everything from workforce analysis. I do work with hospital emergency rooms. We have educational offerings. We do things like this. And we are here simply to benefit, help, come alongside, and raise up rural Georgia and bring the health care that is necessary to take care of our 2.6 million rural Georgians. And we are always here. If there's something that we can do for you pertaining to this program, we're here. If there's anything that strikes you as something that we could help with in your communities, we're more than happy to help in any way that we can. Our contact information has been circling about. It's all over the website, so please do feel free to reach out at any time. We're really eager to partner across the state. And with that, also, this is an evolving thing. And just like we mentioned with the evaluation and how we want to know what works and what doesn't so we can continue, we're hoping that some things will come out of this collaboration in the near future. Paul's been working on a toolkit that was addressed earlier about how can we replicate this, how do we better support our pastors in communities, because that was brought up about, we talk about burnout a lot in healthcare professionals, but let's talk for a minute about burnout within our other caring professions. So I'm really excited to see what the next little bit holds for this program and where it goes in the future. And we hope that all of you will be a part of that journey as we go. A couple of people, just reflecting on today, we had Paul and Terry over to our house for dinner last night. My mother-in-law's in town, and it just so happens, full disclosure, my in-laws and Paul and Terry are very close friends from their many times in Birmingham, and Paul and Terry actually officiated my wedding service. So I've known Paul for quite some time, and many people have actually reflected on the beginnings of this program. And each of us, I noticed today as we recounted how this program came to be, remember certain things and strangely forget other things. But I remember distinctly when the idea was briefed to us about when Greg and Brian kind of brought this idea to the Innovation Center. And I said two things. I said, this is a wonderful idea. It's much needed. I think a lot of great things could be done here, but I have my serious and profound doubts that it's actually going to work. And the reason I have a doubt is because the singular individual who can fill both of those spaces where you speak medical and religious, and you speak to both of them eloquently and patiently, that's a very singular individual, and I made that comment known. And despite that admonition, Greg continued describing his vision, and he said, I really think we can find that person. I said, well, that's going to be a real hard thing to do. He keeps describing this person who's recently relocated. He thinks he might be a good fit. Goes a little further. He gives more detail and more detail and more detail. And it finally dawns on me, and I look Greg in the eye and I said, Greg, are you talking about Paul Bird? And his eyes got about as big as saucers. And I told him, I knew him, and I said, he's probably the only person who could pull this off. So I'm in. And I say that because we've talked a lot today about connections. I've heard it over and over and over again. And one thing I want to leave you all with, in my work, we oftentimes want that connection to lead to something today, and it oftentimes doesn't. We have to come back to that well over and over again before we get water out of it. And I tell you the story about Paul because that connection was deep and meaningful for one reason, and it came to be deep and meaningful for quite another. And I hope that the connections that you have found in this room today, and I hope you've met somebody who's different from you. I really loved what was said just a minute ago, that we need to be in a place where we can be surprised by one another. And I think we need to keep coming back to these wells so that we can continue to foster these relationships, not with an expectation that something's going to happen today, but with the expectation that something will eventually happen. So that's what gives me hope about this program. It's one of the most exciting things I think I've been a part of since I've been at the Innovation Center. And I hope you all have felt that excitement here in the room today. And in the spirit of today, I hope as you go, I'd like to leave you with these words of benediction. May the love which overcomes all differences, which heals all wounds, which puts to flight all fears, which reconciles all who are separated, be in us and among us, now and always. Amen. Thank you for being here.